Thank you for your interest in our PGY2 Pharmacy Residency Program in Ambulatory Care at PeaceHealth Southwest Medical Center and Family Medicine of Southwest Washington, located in Vancouver, Washington, in the beautiful Pacific Northwest.
The philosophy of family medicine emphasizes individual health across the span of a lifetime. It takes the idea of primary care and makes it patient-centered and holistic, integrating treatment of the mind, body, and other social determinants of health. Following in that vein, pharmacists in the family medicine setting practice along the breadth and depth of this care continuum. At PeaceHealth Family Medicine of Southwest Washington, we strive to provide longitudinal care that is compassionate and evidence-based. While we work with many primary care chronic diseases like diabetes, polypharmacy, hypertension, and anticoagulation, we also have the opportunity to provide some specialty services that are becoming more common in the primary care setting, like hepatitis C, HIV, and COPD management. We feel that we have robust clinical pharmacy services, as well as opportunities for growth of services. Yet we're a small enough program that the resident will get to know the RPD and preceptors well, and they will get to know the resident. We value a good, healthy work-life balance for our resident.
While many residencies may focus on having specialty rotations to get you experiences in those areas, we really feel like gaining specialty experience while maintaining the longitudinal primary care setting is really valuable for the resident. We really feel like that helps the resident to expand their comfort zone, learn more deeply about those topics, and it really helps to center the patient care for that patient in their patient-centered medical home, and we feel like that's a really valuable experience. We also feel like these experiences that you're getting are going to help to serve you as a resident once you graduate as well. We really feel like that's going to allow you to come from our program and practice in a lot of other settings outside of the primary care settings. Teaching is another area where we really like to individualize for the resident as well. We really feel like getting teaching experience in a more one-on-one or small group setting can have a lot of valuable impacts for the resident. And so whether that's teaching pharmacy students, pharmacy residents, or medical residents, or even our faculty physician, or doing didactic teaching in our teaching day setting for the medical residents, we really feel like the resident is able to grow their skills as a preceptor and as a teacher in that area as well. Another thing that we really like to emphasize is our involvement as a part of the care team for patients. We have such a great team in addition to the pharmacists that we get to learn from, that we want the resident to be involved in that experience as well.
We feel that continuity of care is a hallmark of ambulatory care pharmacy, and for that reason have designed the year so that after an orientation at the beginning, our resident has continuity experiences throughout all of their rotations, most lasting for the duration of the entire year. Family Medicine of Southwest Washington is the primary clinic for our PGY2 resident. It's a family medicine residency program that is affiliated with the University of Washington School of Medicine. The PGY2 resident spends 3 to 4 days per week throughout the entire year at Family Medicine of Southwest Washington. So this really becomes the resident's home clinic. For the first 6 months of the year, they also spend 1 day a week at another family medicine clinic in the community, PeaceHealth Medical Group Fisher's Landing Clinic. The resident additionally spends half days per week participating in multidisciplinary nursing home rounds at the PeaceHealth Pulmonology Clinic, where they independently provide tobacco cessation services, and our resident is given dedicated time for project and scholarship. 1 day a month, the resident spends on their administrative rotation. The staffing commitment for our program consists of 20 days of covering a clinical pharmacist shift at either of the 2 family medicine clinics. The resident does not work any weekends or holidays. The continuity structure of our program allows the resident to have their own panel of patients that they will manage throughout the entire year, providing ample time to develop strong professional relationships with patients.
I chose this residency program for several reasons. One being I like the longitudinal component and being able to follow my patients throughout the year and see the different medication therapy option choices that we made for the patients and kind of following them through that entire year. I would say one of the things that this residency program and the preceptors focus on doing is trying to give the residents a wide variety of opportunities and experiences, so that way in the future they're able to go to any clinic, essentially any setting, go to any provider, and be able to tackle whatever the provider brings and whatever chronic disease states need to be managed.
The reason I chose to stay on here at PeaceHealth for my PGY2 is because of the high quality preceptors. I really appreciate all the training that they've gone through and being able to bring that experience, as well as how invested they are in teaching.
I was drawn to PeaceHealth because of the wide variety of chronic diseases the pharmacists are involved in. Not only do they do diabetes, hypertension, and anticoagulation, but they're involved with COPD management, HIV intake, and hepatitis C.
We are really fortunate to be located in the state of Washington, which is a very progressive place to practice pharmacy, and especially ambulatory care pharmacy. Pharmacists here are recognized as having provider status, which allows us to be credentialed with insurances to bill for our visits. We are able to truly practice at the top of our license here. We independently manage drug therapy under extensive collaborative drug therapy agreements, and we're highly utilized as a valued member of the healthcare team, where we work side by side with and are treated as colleagues by the physicians and mid-level providers in our clinics.
I can't imagine practicing in a setting where we don't have an interdisciplinary team that has pharmacists. Our Pharm.Ds are magnificent clinical care partners, educators, mentors, and patient advocates. I love having our residents on board as well. This is a great place to train for the ambulatory environment. Our pharmacy partners are indispensable. I think that's the best word and the most appropriate word that I can think of. We'd love to have you come join us.
We are passionate about ambulatory care pharmacy, providing high-quality patient care, and we truly want to see our residents grow and succeed. We are thrilled to practice in an area where we feel valued as part of the team and empowered to make a lasting difference in the lives of our patients, and we hope you feel inspired to work with us as well.